This story is an outbreak of COVID-19 that occurred on a fishery vessel here in the Pacific Northwest. So we'd also done some pre-departure testing for this ship. So we actually had serum from these individuals before they left. And we went back and looked and saw that the 3 people who had neutralizing antibodies, which is one of the thought to be a correlative protection, but hadn't been shown in people yet. The 3 people who had neutralizing antibodies were protected from being infected with SARS-CoV-2. So this is the first time to show that having these antibodies is a correlative protection in people. It's one of the things people have thought would be associated with protection. It's what we followed the vaccine trials for, but really it's the first demonstration that we can sort of protect against reinfection in people. So the other thing is that the antibody titers that they had were not completely off the charts. They're very attainable by the vaccines that we've seen to date. So again, it's a very sort of positive story in that light. It looks like the titers of antibodies that are being made by the vaccine in the phase 1 and phase 2, they've been comparable to levels that have been found in people who are naturally infected. And then here we're showing that those levels don't actually have to be incredibly high for what looks like protection in this particular boat outbreak scenario. It's a fishery vessel, had about 120 people on it. It's not the size of, it's not a cruise ship. It's both sort of a reasonable sized boat, but also not, ginormous. And I think what the main focus for here is just having that high attack rate over a sort of a 2-week window that really indicates we know how transmissible this virus is. This virus has shown the ability to infect a lot of people on boats ever since the beginning of the pandemic. So in a way, we're sort of turning the tide on the ships here. We're using them to learn things about our ability to protect ourselves. We don't know the length. I mean, it takes time, right? The virus has only been present in humans now for about 8 to 10 months, right? To know these sort of things. So it takes time to do these studies to get those longitudinal. We have to find out from them. Ultimately, we're going to really care about is how the vaccines work and how long the immunity lasts there and how long the protection occurs. I mean, that's the real true interesting data point. But we can't answer questions about length right now. I do think that this really highlights the importance of getting serological tests against the spike protein for the virus, which is sort of what we do for hepatitis B. Right, everyone here at University of Washington Medicine's been tested for hepatitis B to show they have antibodies against it and been vaccinated against it. And that's sort of, we know that those are the titers of those antibodies, the levels of binding when we run those assays in the clinical lab, that's a correlative protection, that you're going to be protected against hepatitis B if you're positive by this assay. And that's where we'd like to move towards SARS-CoV-2. It takes time to build that evidence base and to do all the studies. The problem with every longitudinal study is it takes the time it takes, right? You can't speed it up in a way. I mean, the only way we can speed it up is by being here in Seattle. We can sort of go back to those individuals who were infected in February and March because we get the longest of the longitudinal. But really, you're only speeding it up by a handful of weeks there. It just takes time. And so for the people who are currently undergoing the phase 3 trials for vaccines, you can go back to the people who had phase 1 and see how long their antibody titers are lasting. I'm sure that's all these trials for vaccine trials, are more than a year to 2 years to follow those sort of questions because everyone's interested in exactly that question. But right now, we take the good news where we can get it, and right now it suggests that you can be protected against reinfection if you have these neutralizing antibodies. In the short run, it's still social distancing, masking up, trying to prevent transmission of the virus. Keep doing what we're doing here in Washington State. We're doing a pretty good job. Can always do better. We're also doing a pretty good job, all told. And just try to keep this virus at bay until we get those vaccines on board.